Hi everyone, and welcome to another episode of Mind Matters, a head teacher and a psychologist. This week we are joined by Dr Karen Treisman, who is an inspirational professional and a really great friend. She's a clinical psychologist, trainer and author in the areas of trauma, attachment, organisational cultural change and therapeutic ways of being and intervening. She's consultant to numerous organisations around becoming more trauma, adversity and culturally informed, infused and responsive. She's the author of 8 books and 3 sets of cards, and she uses lots of creative and expressive tools and techniques and works in a range of contexts, including global, cross-cultural experiences. She really is an amazing lady to listen to, so enjoy, guys. So it is my absolute pleasure to introduce Karen Treisman with us this afternoon. Karen is a huge inspiration to me and my school, and yeah, we just want to welcome you to begin with, Karen.
Thank you so much for having me. You know, I love you guys and the feeling is mutual. I absolutely adore the work you do, and Yarborough is an incredible academy, so I'm chuffed to be here.
Well, you're part of the team.
Thank you.
So I just wondered if you wanted to start with just you telling us a bit about what your role is, what kind of brought you to this kind of arena. Just to give us a sense of, because obviously I know you well now, we're friends. So I think for the listeners, it would be good for you to introduce yourself a bit.
Yeah, so just to give a bit of background, so I'm a clinical psychologist. I specialise in working with children who have experienced trauma, predominantly relational and developmental trauma, so things like sexual abuse, physical abuse, domestic violence, war-torn situations, but a whole range. So that's sort of therapeutically, and I work using lots of different models that you would have spoken about, and you've done some, from DDP to Theraplay to creative and expressive tools and techniques, video interaction guidance, EMDR, all of those sorts of things. And I guess I train lots of different contexts, from schools to prisons, social services, about understanding about trauma, creative ways of working, but also about organisational culture. I also am a consultant to over 90 organisations to support them on their journey to become more trauma, adversity and culturally informed and responsive, alongside writing a few books.
Just a few things.
Just a few.
I first became aware of you on Twitter, and what I was really struck by was your professional generosity, the way that you really modelled the model in terms of relationships. Can you tell me a little bit about what relationship-based practice means for you?
Yeah, it's a good question. I suppose I'll start with, I don't know if you've explained this before, but just where model the model comes from, because I think that's probably a phrase that I use all the time, that some people it might not be familiar to them. So I suppose that is about how do you treat people, how you want to teach them. So how do you not just talk the talk, but walk the walk? So if I'm talking about compassion, but I'm not showing someone compassion, how am I modelling the model? I'm not giving someone an experience of it. I'm not actually embodying or infusing it. It's just words collecting dust. So that's about sort of how the way you are is congruent with the messages that you're trying to sort of present and show. Relationship-based practice, as you know, because you are brilliant at doing it yourself, it's hugely different areas and ingredients. But to me, there's lots of kind of key elements, and I'll just say a couple of them. It's seeing every young person as unique. I think that is one of the most important things, that you can have concepts and ideas and guiding anchors, but who is that person in front of you? Who is their story? What makes them sparkle? What makes them tick? How can you find a way that matches their learning style? And then how can you make that person feel valued, seen, heard, important? It's that Maya Angelou quote that I say all the time: people will forget what you do and will forget what you say, but they remember how you make them feel. But then it's all those relational qualities. How do you have compassion? How do you increase safety? How do you help someone think about trust? How do you help someone feel that they're held in mind, that they're valuable, that they're important, that they're contained? And that's even more important in the context of trauma, where we know that many children have learnt that relationships are scary or harmful or dangerous. So how are you giving a reparative healing relationship, a different way for children to learn? So I think there's lots of those relational qualities. There's how do you show empathy? How can you be joyful and playful? How can you look at their survivorship? So, but a huge thing is how can you be warm and make people feel at ease and be human? I think that's a massive thing about how can you just have a laugh, have a joke, be real. If you cock up, say it. You know, how can you just have this natural flow and energy? That to me is the sort of magic ingredient. Yeah, in a nutshell.
I think there's something really in that being human, especially with children, that makes them feel safe. Yeah. That it's okay to try these things, and if they don't work out, we can do something different. But I think, you, like you say, you have to model that, don't you? And you have to be true to yourself with that.
Completely.
So thinking about with children, talk to me about the importance of the relationships for child development.
Well, another huge question, I think, in terms of how relationships help child development. And we could look at that from child development, I suppose, is like a massive area made up of different parts of the puzzle. So there's social development, physical development, sensory development, speech and language development, etc., etc. But in essence, children learn through relationships. Children are social creatures. They absorb like sponges what they see, what they notice, how they feel. But actually, and a lot of people don't know this, the brain is experience dependent, it's social dependent. So in essence, through eye-to-eye contact, through having shared experience of looking at something, through games like Peekaboo, we are creating healthy relational experiences and connections, and we're helping children to feel heard and seen. But through healthy relationships, that's what supports children to be able to scaffold and to be able to develop. But also, without those clear foundations, children aren't able to feel safe enough or trusting enough or have this emotional or physical space to be able to invest in learning, because what relationships give them is that safe place, so the secure base, and also the safe haven, the wings and the roots, I suppose.
And
Absolutely.
I guess kind of where we're coming from in school, isn't it? How do we give wings and roots in all relationships that a child experiences?
And it's difficult when you experience children that haven't had those experiences, and it's how you deal with that in a way that's, you know, can heal some of that, I guess.
Yeah. And I think in a school, one of the huge things that you guys see is that for people who have, this might be an unfamiliar concept or a familiar one, is that when children haven't had those foundations and those healing and those reparative experiences, they can socially, emotionally and developmentally be much younger than their chronological age. And that's really hard in school when the curriculum and classes are set for 8-year-olds, but when that child is triggered or dysregulated, they might be responding as a 2 or 3-year-old, and then a few minutes later go older. And that, for a teacher or education or a parent, it's really confusing. How do you do that dance when actually it goes off rhythm and then comes back, and it can be really changeable? So yeah, I think it's a really complex thing and can be quite overwhelming when you see it in practice, especially if you don't understand what you might be seeing.
And I think, for, you know, obviously I've been lucky enough to be with you through lots of your training, and I feel like I've had lots of lovely experiences listening and learning from you. One of the biggest things for me is how we nurture the adults to be able to do that, because, you know, one of the biggest things I've learned in this journey is a relationship with myself and my own triggers, and the fact that I bring a lot to this situation. And in actual fact,
that's one of the trickiest parts, is how you do that with your staff.
Yeah, and that, as you know, is one of my biggest passions, is around organisational culture, that is around the adult's own regulation, own well-being, as you say, own reflective. All of us we're all human, and so we all come with ghosts of the past, angels of the past, our own relational experiences, history, hotspots, because we're all human. You know, you couldn't not have those, and they can be massively resurfaced, stirred up, triggered, and they can spill out. So absolutely. And the quotes which you hear me say a lot of the time is, you know, if a child's in emotional quicksand, we can't get in the emotional quicksand with them. But equally, how can we be limbic whisperers? Limbic is people's fear center, emotional center, if we're as adults in the limbic hijack. So all of the stuff that Kate and I were just talking about, how can you make a child feel safe, trusted, calm, protected, regulated, if you're you can't be the rainbow in the storm if you're in a storm yourself. So yeah, huge amounts about staff well-being regulation, and that feels scary. When you start to put the mirror on yourself, it feels bloody scary, overwhelming, exposing, and it's much easier to position it in the behavior of another person or to look at other people than it is to shine a lens on oneself. You know, it's a hard thing to do.
It is. It's the hardest personally, and to help people through that as well is hard.
Yeah.
I think if you look at traditional models of school, where a child who might communicate their distress through what people would interpret as misbehaviour, it would be very easy to put a lot of blame onto the child and be punishment led. Whereas obviously understanding the importance of relationships as a tool to help you regulate, to learn to effectively co-regulate to begin with and then self-regulate later down the line, that's so important, isn't it? But I think in traditional models, there's almost, it misses that step, and it's like, well, you should be able to do that, and that I've got no part in this, I'm just going to pass that on to you as a child. You hold the responsibility for that.
Yeah, and I think that's a huge thing. And you know, in schools, I think there's starting to be a changing shift of, you know, if a child struggles with English, you help teach them some English skills, or if a child struggles with you know, their lateness, you try and support them around their attendance and punctuality. And I think it is shifting that to thinking about how can we help teach people's skills. But as you say, people can't self-regulate until you've had that co-regulation experience through a relationship. But also how, if I'm with someone who's feeling really anxious, I suddenly feel really anxious. So what, for a teacher, what is the climate that they're setting, or the context, or the weather? And I do think that's a real shift from traditional ways of looking, is how as the adults can we help to be part of that process of holding people in safe hands and thinking minds and regulating bodies, and not positioning all of the difficulties or locating them within someone. It's not about blame or shame, it's about how can we learn the skills. And it's a relationship. We know that how one child is with one person is very different to another person. It's not a personal assault, but it's about that relationship dynamic.
And the idea of our podcast is that we're kind of marrying that world of psychology with education in the classroom. I just wondered if people listening, if you could give them some top tips on where to start or what to think about. What do you think those would be?
It's a tricky one, isn't it? You could talk about child development, you could talk about trauma, you could talk about all of those things. I suppose I would say a few things. I think Twitter's a great place to start in terms of that's how we met. I think there's some really fantastic people on there. I think in the education world, I think Louise Michelle Bomba has some fantastic resources and books. I think Bruce Perry, as we know,
she says,
there we are. Here's one you named earlier.
Just doing a book study on that with some
staff. There you go. And she's got her new book that came out last week. I think there's some really good resources from Beacon House that are a fantastic place to start. I think lots of my resources around the therapeutic treasure box, but also the children's books like Presley the Pug on emotional regulation, or Jilly the Giraffe on self-esteem, Heather Geddes. And if people are more interested in the relational side, you know, things like by Dan Hughes and Kim Golding around DDP. And for those who are interested in separating the behaviour from the child, which I think is a huge thing that can be integrated into any way of working, that's really from narrative therapy. And you know, you can read up lots around narrative therapy tools and techniques that is accessible for many people, not just therapists, around how do you help to reframe and separate that behaviour. So yeah, there's loads more, but those would be some of the places that I would start. Inner World Works, they've got some fantastic stuff as well. Yeah, I think those are a few off the top of my head.
Yeah, and all amazing resources. Yours particularly, as you know, Karen, we've taken a really run with in our school, to have that really good go-to that has relationships at the heart, I think, and it's done in a way that really fits our school. But we were talking earlier about how a lot of the time people are just looking for something to buy, something to read. When in actual fact, it's a lot about relational climate and how you trust in that the gold is within yourself.
Yeah, and I think that's a huge thing about knowing that we are our greatest treasure. And I always say you can have the best tools under the sun, but they are meaningless. And I say about my books, I think they're pretty cool, but chuck them in the bin if you don't have that relational foundation, and if they're not done in a way that that child feels seen and heard and valued. And I think what you guys did, you know, let's take Presley the Pug as an example. For those who don't know, Presley the Pug is about a 250-page workbook around emotional regulation for all children. What many schools have done is a Senko's gone and trained in it, or their school therapist has gone and trained in it, or a few people pick and choose. And there's some great stuff in that. But I think what you guys did is you got, you know, all of your teaching assistants alongside another school's teaching assistants, and you and Kate all came and spent 2 days embedding and learning it. And that was following on from having an initial baseline training on understanding trauma and our own regulation. So you had that whole school approach, and you brought the resources so that people felt valued and had them accessible, and then have continued that through Kate running amazing reflective practice sessions on it, through people doing reflective art, through having a Facebook group. So to me, and what you did is you did that when you guys already have created this amazing relational culture. So it didn't feel like it was coming from left field. You'd done so much groundwork and so much that the concepts weren't new or out there. You'd sort of set the fertile soil, which I could just plant a bit more, and are continuing to do that. And I think that's the magic about whole school cultural change, rather than just a little bit here or a little bit better there and a bit patchwork. So whilst there's merits in that, I think the fruits of your labour of actually really, and those teaching assistants were phenomenal and so invested and so
and still are, remain to be.
Still are. And I think that says a huge amount about them, about you guys, about the school.
I mean, I think it says a lot when obviously people might be reading, listening back to this and don't realise that we're currently in coronavirus lockdown, but so much so that some of our TAs have even been running sessions over the phone and via Zoom using Presley. So I think even then a lot of them have said they've used a lot of the techniques for themselves during these tricky times. So you're right, it's how you begin that as an organisation. It can't just be something that you pick and choose. It's something that you're all in with. Yeah,
absolutely. And how, you as the head teacher, and I do think, whilst I'm all for community and grassroots, I do think a huge amount comes from leadership, modelling the model. Same as with children, a lot is from parents. And I think you not only really kind of cheerleading it and investing in it, but you were physically present there and engaged. And I think all of that and linking it to the model, that gives people the sense of we're part of something, and this isn't just going to be initiative fatigue. And I think that's what happens, is there's this, oh, this is the sexy thing today, and next month we're going to do,
and that is prevalent in primary schools. Like, it's the next big thing, like, let's jump on the next bandwagon. It feels, you know, I've worked in schools like that
completely, and it happens all the time. Whereas I think for what you guys have created is, this is our model, this is our approach, and everything we do is to enhance and continue that approach. So it doesn't feel piecemeal, it feels very integrated and cohesive, and that's a phenomenal thing that I hope that more schools do, because it's the pandemic is, I was just saying to you guys before we were recording, is proof of the pudding that people have felt really held in mind and really connected. And I think when you've got a time of uncertainty and fragmentation and disconnection, for people to be saying we feel really held and really thought about, that shows how much that foundation has set a bridge, and it's set such a strong kind of springboard. So yeah, I think it's hugely important, and we probably have seen the benefits now more than before.
Yeah, and I think there's a lot going around. I've had meetings myself with people talking about recovery curriculums and how we recover from this as a school community and what we can do now. But in actual fact, you know, you've got to work with the culture that you've got. Like you say, it can't be left field, because it will just be disingenuous.
Yeah, I think
it wouldn't be psychologically safe.
No.
Jump back in with something quite vulnerable and exposing without the safety mechanisms built in would just make the danger even greater. And I think you're right, when we were talking about what's fallen out of lockdown, is that some of the families that for whatever reason we've not been quite as accessible for, there has been something in this situation that has enabled us to build those bridges and be able to kind of do the work that we wanted to do, even if it's at distance to begin with, that obviously feels safer in some way. And that's been something really special, to build relationships with families that previously maybe we didn't have, or we hadn't sown the seeds in the right way for them.
Yeah, and I think that's huge, and I love that you've had that experience. And I think you're right. I think some of the virtual ways of working, or what's been brought up in the pandemic, has really allowed a different way of working, and that you've been able to create that. But I also think it shows as the foundations. We know that some kids have literally not heard from their schools in the whole however 8-9 weeks, whereas I know that you guys have really actively done so many creative things to keep in people's minds and hearts, and it's been really reciprocal. And I think I will say that Maya Angelou quote again, when people come out, how are they going to be made to feel? And this is a really important part for other schools and other places to think about. What is our legacy? When people think about how do we treat them and make them feel during this time, it's a massive opportunity to really say to people, you are important, we are here, we do care for you. And I think you guys have done that beautifully. But I think some people are seeing it as out of sight, out of mind, possibly, and actually this is one of the most important times to really show the opposite.
I remember the first time I heard you talk, Karen, you talked about a school being a brick parent, or an organisation being a brick parent.
Yeah.
And during difficult times, that brick parent doesn't abandon you.
Yeah. And it's such a powerful concept, that brick parent, and it's how we increasing security, safety, being held, being contained. What are those messages that we want people to pick up? And that brick parent doesn't need to be an actual brick parent, because it is, as we know, it's so much more about the community. So yeah, I think there's a huge
one of my big realizations is my school's not about the building, it's about the family that's inside of it. And whether that's remote or whether that's in one physical space, we can be creative enough to find that wherever.
Yeah, and I love that. And what's so beautiful to me about that is those children, when they leave your school, that's what you want them to internalize and take with them for the rest of their lives. And I think that's, to me, the bit that I always find makes me quite emotional, because I always think we all have those school experiences that guide us throughout our lives, positively, in all the shades. We all have those teachers who shaped us, inspired us, stuck with us, made us to feel stupid, all of those different things. And that's why it's so much beyond the building, because it travels with you. And I think that's the beauty of what you guys are doing, of what you're setting, that will travel with kids throughout their life journey, and those parents as well.
One of the big things that I talk about with my team is around when these children are grown up and they've got their own children, and on the first day that they take their child to nursery, I want them to bend down and say to their child, do you know what, I remember my first teacher, and she was so kind, and he did this and they did this, and you're just going to have the best day. I still remember them now, and it was really good. And then send their child in. That's what I want, that for us to be that person that they can then reflect on and say, they gave me such a good experience. I also want our parents to know how grateful we are for them to lend us their most precious children for several years and trust us to guide them in the way that we do. And they're the two things I want from my team, is to understand that we are so important in this journey, but don't ever take that for granted, because it's a real honour.
Yeah, and I love that. And I think that's such a beautiful thing to really acknowledge that, because I think that can be lost sometimes in education. It can feel sometimes like a burden or a job, and I think to have that sense of, wow, this is a gift that we have, that you are lending us, but also the amount of influence that we can have. I think that's a huge thing to hold on to, and as you say, that positive experience that they can take of school. And I always say about your guys' school is, when I went there, it was the first time, I didn't particularly love school. It was the first time that I've walked through a school that I thought, I'd quite like to go to this school as a student. And I think that is an amazing thing that you guys have been working towards and achieving. So, yeah.
And that's the kind of conditions that we want all children to experience.
Absolutely. And I often hear from especially at the beginning of our journey, was around, this kind of work is only for children that have experienced trauma. Whereas, the realization is that it's a healthy environment for all children, all people. And Karen, I remember you telling us a really great analogy about going to a hospital and wearing gloves. I did try to do it, I think, another episode, but you do it far better than me.
So I guess there's a few things with that. So first, it's always to hold in mind that everyone benefits from a nurturing relational environment. And yes, it might be particularly useful for children who have experienced trauma, but trauma is a really wide lens, so there's not just relational and developmental trauma, there's bullying, there's people going through frictional divorces, there is children with additional learning disabilities or additional health needs, or intergenerational cultural trauma, poverty, racism. So looking at all of that, but all of us want our children to have positive emotional vocabulary, emotional literacy. So it is much more than that. But I suppose the quote is by Alexander Den Heijer: if a flower doesn't bloom, you don't fix the flower, you don't blame the flower, you don't humiliate the flower, you don't try and make the environment more stressful, you try and create an environment which allows flowers to bloom and flourish. And how that mixes with the gloves is, for example, when you go to the hospital, and interestingly talking about this in the midst of a pandemic, but when you go to a hospital, the nurses and the doctors wear gloves for everyone, because they assume that everyone might have a blood-borne infection. And so they don't check you at the hospital door to see, they just assume that everyone might have that. And so they create an environment that is inclusive and that is useful for everyone. And I suppose the other analogy, hospital one, I often use about that is that for any of you who have gone to have a chest x-ray or something like that, you will know that we are often put in gowns where your arse is hanging out, and it's a little bit revealing and exposing. And there'll be a bunch of people who really don't care. They're just like, whatever, it is what it is. There'll be a whole bunch in the middle who feel a bit awkward, a bit uncomfortable, a bit exposed. Oh, this is not very nice. And there'll be a group of people who that feels humiliating. That feels so exposing, re-triggering, stressful, really, really difficult for various different reasons. If we come up with a procedure that makes that gown more trauma informed, the people who didn't care, they're not going to care, and it's not going to make any difference. It's not going to add harm. The people in the middle, it's going to make a huge difference to it just being a much nicer experience. And people who found it really difficult, it's going to make a world of a difference. And that's the idea of making relational, humanizing, trauma-informed schools and systems, is that how can we make it a healing, reparative place for everyone that's inclusive for the teachers, the parents, and the children, rather than just picking one or the other. The other big thing about that is that for trauma and distress, it's generally invisible. We don't know when it's there. When someone's in a wheelchair, we can see they're in a wheelchair. When someone has Down syndrome, we can see they have Down syndrome. But when someone is in distress, we can't see that. It's cloaked, it's beneath them. It is the sense of we're not able to have an emotional x-ray. So why don't we create environments that tread carefully and support people, in essence?
Absolutely. And I think just listening to you and reflecting on my own experiences in leading a school through this work, that in actual fact, it's not easier, but I guess it's because I'm a teacher, I can do that more easily for the children. But for the biggest thing for me was around how we do that for staff. How do I make that kind of environment for a staff member? And also for parents.
Yeah, and that's a huge thing. And just to build on that, and that from our trauma-informed organisational stuff, is if we take something as simple, I'm putting that in brackets, is as a team meeting, what might a team meeting feel like for a staff member who's just been told they're a shit, horrific teacher and they should quit their job? What might that team meeting be like for a teacher who's having huge difficulties with their own child at home? What might that be like for that teacher who has been really triggered and dysregulated, or is having a medical test the next day that they're feeling really worried about? Same as the physical environment. What's that staff room like? Is it a place of sanctuary and safety that's going to help them regulate, or is it stress inducing and trauma inducing? And that's, as you say, the difference of not just thinking about the kids, but thinking about the staff, and how schools, to me, should be about positive role models, about thinking adults, about adults who are able to tolerate lots of things, but they can only do that if we then also help them. It's how do you care for the carer? So yeah, I think it's a real shift for thinking about things, but also not just seeing adults as adults, and that's not babying people, but just honouring that all of us have our own inner child. All of us have, as I said before, our own little prickly parts that are important to attend to.
It's making an environment that's safe for everyone to show their prickly parts.
Absolutely. And how can we expect children to be able to do it if adults aren't able to do it? It's the same as how can we ask children to reflect or talk about their feelings or name their feelings if, as the adults, we're not able to model the model and to do that ourselves? How can you teach a skill that you don't exercise yourself? And yeah, I think that's a huge, and it's making it safe enough to be able to do that. That vulnerability, lots of people love Brené Brown stuff, that vulnerability is a real strength.
Got a Brené book next to me as well, Drew.
There you go.
A little quote from her behind me.
We should have invited Brené on.
That would be cool.
A conversation with you, Karen, and Brené is like my, when you have those like dinner party guests, when people say like, who are your ultimate guests, that would be mine.
I love that. Can we please make that happen?
Let's do
I
it.
mean, see what we can do.
I did have a dream the other day that Oprah came to me very clearly and told me about my next book, which I'm now writing.
Wow.
How can you turn down Oprah? So
You can't.
can we get Oprah into the mix?
We'll add her into the dinner party. Anyone you
We
want to
can
add, Kate?
Love it. I'm there.
Could we have Bruce Perry?
Oh, well,
Bruce, of course.
and if we could bring back people, Nelson Mandela thrown into the mix, Maya Angelou.
Yeah.
Now this is the dinner party.
Now we are into a dinner party. Then we'll have to go onto the food menu because we know we all like our food.
Oh yes, yeah. Let's not go there.
I think we've talked about that a lot on the podcast. However,
Every week we talk about food.
Oh yes, I mean, I definitely need to socially distance from the fridge at the moment.
so
It's funny because when we were talking to Emma, we were, you know, a previous head teacher on the podcast. She was talking about how she shows a lot of her gratitude through food. She finds that giving of food away one of the only ways she can physically show her appreciation. Interesting.
It is. It's a love language, isn't it? And it's very tangible. And I think there's something about those tangible things that just send a huge message without even needing to say that. And I think, you know, you guys do a lot of those things. You went and put signs outside people's houses and made, you know, t-shirts for people. And you know, when I was there, you made me an amazing personalized piece of art. It's they're small touches, but they're big touches. They make a huge message, I think, that really gives people that sense of you're valued and you're important. And it gives tangible reminders so that when we are all a bit dysregulated, we can look around and see that sign or see that cushion or see that mural or whatever it is, to just sort of anchor us back.
So I know that earlier we were talking about not expecting children to do something if adults aren't willing to do that themselves and working on ourselves. I know me and Hannah have been talking about this for a little while. Often adults have a choice about going to therapy. It's something they choose to do. But we're recognising that some children don't seem to have a choice for this. They're referred in by parents, by teachers, and sometimes a collaboration between parents and teachers. I just wondered what your kind of view on that was.
Yeah, I think it's a real big ethical dilemma, and it is a very much it's one of the really tricky things I think about being a child as well, is that there's that lack of agency and control and mastery and other people making decisions for you. And therapy generally, unless it's court mandated, is a choice. And I think, as you say, adults have a choice. I would like to see supervision and reflective practice as a essential within schools, but of course that's different to therapy, and I think that's really important, that people get therapy muddled up with supervision and reflective practice, and it's really important to have the difference. I think with children it's really, really important to think about, is a referral appropriate? What is the timing about that referral? How can we look at it systemically so that it doesn't just position the difficulties within the child? How do we help think about what the wider system might benefit? And that's not putting a problem within someone, but it's actually thinking, let's all be part of the solution and let's work together. But I think because of what happens with that, there is this notion that therapy helps everyone, and it doesn't. Therapy can be amazingly helpful, but it is not appropriate and it does not work for everyone, which is why having that therapeutic environment, the whole school approach, is going to make a far bigger difference, because that's 8 hours a day versus 1 hour every week. So I think that's huge. But I think the other thing that we see in therapy when children have been forced to go is we might often see children who resent it, children who are feeling highly anxious about it, children who internalize something's wrong with me, children who clam up and who bottle up and just retreat. So I think that it can make the process much harder. And so we also need to think about, how do we make that as safe space as possible, but how do we also really understand that that child knows why the decision's been made and what else is being put into place, and to name and acknowledge that it hasn't necessarily been a choice. But I'm always one about going at people's pace and making a space, but also not forcing or pushing people to do something that they're not ready to do. I certainly wouldn't want someone to push and force me to go to somewhere where I wasn't ready. However, I'd appreciate someone giving me the options and letting me know the space, and thinking about it. And again, there's a difference between direct work and therapy. So I don't know if that answers, but that's just a few of the thoughts whirling in my mind.
I think it fits quite well with the discussion we've been having. It comes back to those gloves, doesn't it? If we've got gloves on for everyone, if we've got that environment for everyone in the classroom, actually it's not as scary to begin that process when you're already held in that way as a standard for everyone.
Yeah, two reflections about that from my point of view is, number one, how do we build more of those processes in for our staff? I know we talked a lot about supervision, haven't we, Karen, and how important that is with this kind of work. And interestingly, I had a discussion with some staff about that yesterday, is how do we build in that reflective space for them? So I think it's crucial. And also, when you talk about we need to move from knowing into being, like for a lot of our staff, and me included, you know, I've done a lot of training, but it's not about knowing, it's about how you embody that in every interaction.
Yeah, and I think that's a huge, and that's I mean, in the trauma world, that's the moving from trauma informed to trauma responsive. But taking the trauma aside, that is about not just talking the talk but walking the walk. How can you move from knowing, from having the information, but to being, to feeling, and to doing? You might know that behavior is communication. You might know that you need to respond, as they say in DDP, connection before correction. But knowing that academically, intellectually, doesn't mean that in the moment when a child is shouting or screaming or throwing a chair, that you're able to do that. And that's exactly why it's about doing it so much that it almost goes into your muscle memory, but also that there's a space where we're all gonna screw up and that we can learn from it. And none of us, you know, I muck up all the time, so it's thinking about being human, but having those reflective practice and supervision spaces so that it's infused into everything we do, everything we are, into our language. And when you've got more spaces like that, it just allows people to stop and think. And it does become a bit like riding the bike. The more you do it, the more it becomes like your skin, but it feels really awkward and clunky and against your grain. Even more so if you were a teacher, for example, who's been working for 20 years in a very behavioural model and way of working, that feels really overwhelming and de-skilling and having to sort of completely have a culture shift. And that takes a lot of time and thinking and practice. But your other reflection point about supervision and access, I think it's been really interesting this pandemic, because some of the organisations I support have previously offered me to do one-to-one sessions for staff who had a particular theme or area that they were struggling, and very rarely they were taken up. And since this pandemic, I've had about 30 requests a day for people to take that up and people to talk about what they're feeling, what they're responding to, what they're noticing in themselves, what their triggers have been, what the dynamics have been with other staff members, because that's brought to the forefront, what they're grappling with their own personal lives. And to me, that's a real strength of the need and the benefit. But also I hope that this is going to facilitate more opportunities to know that having another mind to think things through and a space to think things through isn't saying that there's a problem or something's wrong. It's just modelling having time to have someone who's not emotionally invested have a bit of distance, and just to help organise your thinking a little bit. And we all need it. As a clinician, it is an absolute mandatory, cannot do without it. But in the education profession, it hasn't been something that's been prioritised. And I think people have funny things around supervision, thinking it's like micromanaging or checking how you're doing. as opposed to, if you break up the word, supervision. It's about having an enhanced vision, about enriching, about being able to take pride in your work, about being able to really think about it, reflect instead of react. And I think that's, I read a quote recently by Shohut, which is a book I was telling Kate about called In Love with Supervision, that says not having reflective practice or supervision is like swallowing food whole. You're going to vomit it up.
And I've got the book just here next to me.
Well, we're just walking libraries, aren't we, today?
Kate's amazing. Both of you are phenomenal. You're the only people who I actually give a suggestion and you actually go and buy it or read it. It's just perfect students.
The thing is, I feel that that's where we're at. That's where my school is at. Is that moving into being, and it's that space to be able to process that.
Yeah.
How that will work within a school, I'm not quite sure. And I think you're right. My first initial experience of supervision was like a mini telling off about what I've not done right.
Yeah.
And I've quickly learned that that's not the idea. But I think when you're doing this kind of work that is relational, and it is, as we talk about all the time, you invest yourself into this, then therefore you need that space to reflect on your own actions.
And I think that's a massive thing that needs to be done for anyone listening. One of the first hurdles is to name all of those elephants in the room about previous experience of, it's a bit like team meeting, previous experience of supervision, fears, apprehensions, hope. What would the worst case example be? What would the worst scenario be of supervision? How would you be left feeling? Because I think it is, a lot of people come with either having had negative, harmful experiences or having kind of preconceptions about that. And that's what's really important to think about. What do we not want it to be? And that's why I've stopped calling it supervision. I've actually started choosing a different name, whether it's about a we space, a shared space, a formulation space, a reflective space, whatever it is, I get people to choose the name, because I think supervision, unfortunately, for many people has now taken on negative micromanaging experiences.
I think I'm really cautious with that as well. That I remember staff saying, but what is supervision? What do you do when you go to it? And I'm so fortunate that I kind of straddle between education and psych. I'm so lucky in that respect. And I do go to supervision in school time. That happens every other week, but I'm always really open with staff saying that that's where I'm going to supervision. And obviously I run some supervision sessions as well each week for the care team, and I think it's nice for them to be able to see and ask, and it's nice seeing other staff, after we've made it so normal, this is just part of what we do, that staff will then say, can I come to supervision? And I think that's a real nice point where people get to, where they're like, I'm curious, but safe enough to say I want to come in there and try that.
Yeah, I love that. And it is that osmosis, isn't it? Is that when it feels safe and something that's not scary or overwhelming, then you pique people's curiosity and people are able to engage in that way. Like, it's, yeah, I think that's a beautiful thing. And it does feel, for some people, when it's so unfamiliar, you're like, what is going to happen? What is it? And so just giving people a bit of an experience of what that might be, I think is hugely beneficial, but also acknowledging that it's not for everyone. And that's the trauma informed way, isn't it? That people can opt out, that people can be silent if that's where they need to be, that some people might need individual instead of group, because groups can bring about all sorts of big things for people. And it's the same as when you do any activity, you know, in a check-in, in a team meeting, how we also allow people to say it's okay if you want to pass. So it's not just the stuff, it's the nuances between how they've been delivered. And I think that's sort of the magic within it, which, you know, you do so beautifully in the ones that you facilitate.
And I think from attending your therapeutic treasure box training, Karen, in that doesn't have to be something that's old-fashioned and you sit and you talk. It can be a creative space. And I think I've learned so much about how you interact with children around feelings and how you create that therapeutic moment, not necessarily in a therapy session, but how you can do that in so many creative ways. And so much of your work is about how you can do that with real creativity in mind.
Yeah, and that's what I love. And actually with adults as well, that it doesn't have to be dry and boring and using words, that it can be so creative and expressive. And I think from that, it's a nicer experience for the child, it's a nicer experience for the adult, and you get so much more rich information. But even sort of traditional things that schools do around thinking about consequences and reasons for behaviour, and all of those things, that they can be done in creative ways, you know, with puppets and masks and miniatures and polystyrene heads, and you can tailor it. If a child's into unicorns, how do you make it about unicorns? If a child's into graffiti. So I think absolutely that thinking beyond words and finding creative ways to help children to express themselves, we get the best, and it feels less stressful. And I think that's the magic, is not just feeling like we have to sit down and think about what were the advantages and disadvantages of that incident that we saw, or, you know, how are you feeling about maths lesson after you were excluded, that we can actually do it in a way that's likely to get more information and that's likely to stick in someone's mind and is relational, that they are going to leave there feeling like that was actually quite fun, that was quite interesting, that made me think, I felt really valued. That's the magic of doing things in a creative way, and it's much more child-centered. And for adults, you know, we also love that. You know, if anything, adults love it more. We're so bored of going and having tick boxes, and we've lost the play and the fun. So yeah, I think we all could do with a bit more creativity and fun and play, really.
And it stops it from being scary, I think.
Yeah,
because I think, you know, through the pandemic, we've been doing lots of checks in with our staff about feelings, and I think it was your idea that you discussed with Kate about doing an object check-in, of which we've done weekly with our staff. And even just that really simple thing has stopped it being, well, we're going to have to talk about how we feel.
Yeah.
And
completely.
in actual fact, the reflection, my own reflection on the items I've picked, and then I've thought really quite deeply about some of them. I thought, whoa, didn't even realize I thought that.
Yeah.
So even those little things, like you say, they don't have to be huge, they don't have to be highfalutin, or sometimes there's,
you take that as far as you want to, don't you?
Yeah.
Your object, you have control over what you share. You don't have to do it, but you can explore that to whatever depth you want to do, knowing that the care team are there to support you if you need it.
Yeah, and it's those huge things, as you say, you know, virtually using cards to show how you're feeling, using the miniatures, changing your name on Zoom to being something that you're feeling. You know, there's lots of things, but they make you think, they make it a bit more playful, they make it a bit more engaging. But also, I think children particularly get so bored of being asked the same thing over and over again by so many different adults. So how can we ask something in a much more engaging way, that allows them to also find their own meaning making and sense making? And I think that's the huge thing, is that there's no right or wrong. It's what that world or feelings look like to that specific child. And I think creative ways really help them to do that in a much more accessible, human, universal way, really.
So obviously, to support those wonderful creative experiences for our children, we use all of your lovely resources. Karen, I just wondered if you wanted to signpost people to where they can find out some more.
Yeah, so I've got a website which is www.safehandsthinkingminds.co.uk. So that's got loads of stuff on there, creative resources that are not my own, different puppets, different masks. It's got a special page for COVID. It's now got an online module page with a new module I've got, and I'm going to add loads to that. And it's got all my books and cards and resources. So I've got seven different books, 3 different sets of cards, 5 cuddly toys, and I am about to have 2 more books and 2 more sets of cards next year. So lots and lots of things on topics from self-esteem, emotional regulation, trauma, nightmares, sleep difficulties, anxiety, lots and lots of different types. But there's also on there loads of links, your ones on there, links to podcasts, links to Beacon House, who I spoke about. So every time there's a really good website or something, I try and put it on there. And really active on Twitter, as I think it's Dr _Treisman, TREISMAN. And I have a Facebook group, Safe Hands and Thinking Minds. It was a mouthful, but I think that's it.
I can't recommend your resources any higher. They are wonderful. They're our go-to most days in school, and they're done in such a lovely and really accessible way, I guess, and something that we reach to all the time. And your Facebook group is a real wonderful community to be part of, to kind of see other people's work, and that's really important part of our journey is sharing that and gleaning good practice from other places. And we're not on our own in that. So we just want to say a huge thank you for your time, Karen. As always, you are an inspiration. I've written a list while we've been talking of things I want to go and think about more. But yeah, we truly treasure you. You are so important to us. So thank you so much for sharing.
Thank you. And thank you guys. I adore you. I think the work you're doing is sensational. I haven't seen a school in England that I would rave as much about, and just as humans and practitioners, and you know me, I don't bullshit, so when I say I genuinely mean it. So thank you for having me, thank you for doing this podcast, thank you for the amazing work you do, and I'm sending big virtual hugs, and I can't wait till when we're together in person again.
Real hugs soon, I hope. So thanks everyone for listening. Please subscribe to wherever you find your podcast usually. You can subscribe on YouTube and SoundCloud as well. And thanks very much for listening.